The best treatments for osteoarthritis really involves looking at the holistic management of the disease. And there I mean specifically paying attention to why you developed osteoarthritis in the first place, and paying particular attention to non-pharmacological, non-medical and non-surgical treatments in the first instance. And that's what most guidelines would advocate for. So I'm there thinking about trying to particularly focus on, if you're overweight and obese, losing weight, particularly if you're sedentary or your muscles around your joints are not particularly strong, trying to improve muscular strength, aerobic or cardiovascular fitness as well. And again, if you're depressed and or if you've got significant psychological impairment, either as a consequence of the disease or as a complete separate entity, paying particular attention to the treatment and management of that as well. Following appropriate non-pharmacologic conservative management, weight loss, exercise, using braces, paying attention to psychological needs, then it might be appropriate to use analgesic medication, pain-relieving medication, such as anti-inflammatories, topical ointments, that may help to facilitate the treatment of the disease. If they are also ineffective at managing the symptoms that relate to the disease, then surgery may be an option. The benefits of exercise for a person with osteoarthritis are multiple. First and foremost, you'll improve the strength of the muscles around the joints that are affected and improve their stability, their motion, and your ability to function with a joint that has osteoarthritis. In addition, aerobic and cardiovascular exercise are helpful in improving a person's body weight, their stamina and their ability to do exercise, in addition to improving their cognitive status, their ability to help deal with other aspects of the disease. The benefits of losing weight for a person with osteoarthritis include meaningful improvements in a person's pain, improvements in function, and improvements in the long-term disease course, so the likelihood of a joint structurally changing over time, and by so doing reduce your chance of requiring a joint replacement. And in addition to that, there are also mortality benefits, so you're less likely to die if you lose weight in the context of osteoarthritis. But most important is those really critically and meaningful improvements in a person's pain. If you lose 10% of your body weight, you can expect a 50% improvement in the pain coming from your knee with osteoarthritis. Complementary medicines in osteoarthritis are incredibly widely used. About 50% of my patients and those in the community are taking complementary and or alternative medicines. They're widely publicized, widely marketed, and they've been also widely researched. And I think it's incredibly important for the person with osteoarthritis that they understand what they're putting into themselves and that have good evidence to support its efficacy for what you want it to do for your osteoarthritis pain or structure of the joint long term. Oftentimes the trials that have looked at the use of alternative or complementary medicines have found them to be no better than a placebo, a sugar pill. In the context of taking over-the-counter supplements such as glucosamine, this has often been found to be the case. There's no problem if you're getting good relief of your pain with taking a relatively safe and relatively inexpensive product like glucosamine for you to continue to take it and redeem the placebo-related benefits associated with that.